The neck can be divided into three main regions by two major muscles: sternocleidomastoid muscle and trapezius muscle. Anteriorly to sternocleidomastoid, there lies anterior cervical region. It is bounded anteriorly by median plane of the body and superiorly by the border of the mandible. Between sternocleidomastoid and trapezius, there is lateral cervical region. Inferiorly, it is bounded by the clavicle. And posteriorly to the anterior border of the trapezius, there is posterior cervical region. Anterior cervical region can be further subdivided into four smaller triangles. Borders of those triangles are made by infrahyoid and suprahyoid muscles. Superior belly of omohyoid muscle separates muscular triangle from carotid triangle. Posterior belly of digastric muscle separates carotid triangle from submandibular triangle, and anterior belly of digastric muscle separates submandibular triangle from submental triangle. Within the lateral cervical region, we can distinguish two triangles, the occipital triangle and omohyoid triangle, separated by inferior belly of omohyoid muscle. We usually distinguish superficial cervical fascia and deep cervical fascia. Superficial cervical fascia is just a thin layer of subcutaneous tissue located between the skin and investing layer of deep cervical fascia. It contains fat, platysma, and some superficial veins. Deep cervical fascia is much more complex structure. We usually distinguish three layers: investing or superficial layer, pretracheal layer, and prevertebral or deep layer. Investing layer of deep cervical fascia, colored blue on this schematic, is the most superficial layer. It covers entire neck and bifurcates, covering sternocleidomastoid muscles and trapezius muscles, wrapping them from both sides. Pretracheal layer of deep cervical fascia is limited to anterior part of neck. It can be divided into muscular part, colored green, that covers infrahyoid muscles, and visceral part, colored yellow, that wraps around viscera of neck, like thyroid gland, trachea, and esophagus. Laterally, pretracheal layer extends from carotid sheath, colored purple, that covers biggest blood vessels and nerves of neck, common and internal carotid artery, internal jugular vein, and vagus nerve, together with some lymph nodes and sympathetic nerves. Prevertebral layer of deep cervical fascia, colored pink, is the deepest one, covering deep cervical muscles and vertebral column. Usually we distinguish also something called alar fascia, that layer that has been added in color black on this schematic. It is located between visceral part of pretracheal layer and prevertebral layer of deep cervical fascia, extending between both carotid sheaths. It divides this space, called retropharyngeal space, into anterior, proper part of retropharyngeal space, and posterior, sometimes called danger space, because of risk of spread of infection from neck to the chest. Cervical plexus is created by anterior rami of spinal nerves from C1 to C4. Those rami create loop-like connections between each other and then give their branches. Branches of cervical plexus can be divided into cutaneous branches and muscular branches. Cutaneous branches are responsible for sensory innervation of the skin. We can name 4 main cutaneous branches: the lesser occipital nerve, great auricular nerve, transverse cervical nerve, and supraclavicular nerves. Usually there are 3 supraclavicular nerves: medial, intermediate, and lateral. All those cutaneous branches merge from one point at the posterior border of sternocleidomastoid muscle. We call this the nerve point of the neck. Muscular branches of cervical plexus are responsible for motor innervation of different muscles. Biggest of them is known as phrenic nerve. Phrenic nerve runs inferiorly on anterior surface of anterior scalene muscle. It goes between subclavian vein and subclavian artery, enters thoracic cavity, and then runs towards diaphragm, which it innervates. Another muscular branch of cervical plexus is known as ansa cervicalis. It forms a loop located on anterior surface of carotid arteries. It is created by superior root of ansa cervicalis and inferior root of ansa cervicalis. Superior root at its very beginning runs together with hypoglossal nerve. Regarding veins of the neck, we can distinguish 3 main vessels. The biggest of them is known as internal jugular vein. Internal jugular vein is the biggest vein within our neck. It's the main route of venous drainage from our head and neck. It runs from the level of the base of the skull downwards to the chest. It begins as direct elongation of sigmoid sinus within jugular foramen between occipital and temporal bone. Within this foramen, it forms a widening that is called superior bulb of internal jugular vein. Then it runs downwards within carotid sheath together with, at first, internal carotid artery and then common carotid artery. It terminates within the chest, forming a bit of the widening called inferior bulb of internal jugular vein, and then connects with subclavian vein to form brachiocephalic vein. Another blood vessel that we will mention is known as external jugular vein. It runs at lateral aspect of our neck. It begins as junction of posterior auricular vein and posterior division of retromandibular vein. Anterior division of retromandibular vein sometimes connects with facial vein to form a tiny blood vessel known as common facial vein that usually drains to internal jugular vein. External jugular vein runs downwards and joins either subclavian or internal jugular vein. The last vein that we will mention is known as anterior jugular vein. It is usually tiny vessel running downwards from the proximity of hyoid bone, descending to join usually internal jugular vein or subclavian vein or sometimes brachiocephalic vein. Please remember that anatomy of veins, so their size, their course, and sometimes some accessory connections between two vessels is variable, so it may sometimes differ between two people.